Hello, my name is Kristen Hoban, and I am a health educator with Weller Health Education at Lehigh Valley Riley Children's Hospital. I want to thank the EPC SAC group for inviting me to speak at their meeting today. We're going to be talking about a pretty important topic, COVID-19 fatigue. We are 9 months into this pandemic, and COVID fatigue is a real thing. A lot of people are struggling right now. So we're going to talk a little bit more about what is COVID fatigue, what we can do about it, how you can help yourself, and how you can be a support for your peers as well. So I know our time is limited, so we are going to get right into things. Okay, so the phrase COVID-19 fatigue has been going around for a couple of months now. And what it implies is that a person has reached their capacity to cope and is experiencing various mental, emotional, and physical symptoms as a result of the constant exposure to pandemic stressors. Some of those stressors include social distancing, isolation from family and friends, fears of contracting COVID-19, virtual school, virtual meetings, grief, and financial stresses. So there are lots of stressors right now, all piling up on folks, and people are really struggling. So they're really, really feeling this fatigue. It's been a long time, and it's really it's really difficult, and I get that, and everybody recognizes that, and especially difficult for teenagers at this stage of your life and your development. You crave interaction with one another, and you're not able to get that right now, and so it makes things really that much harder on you. I know that you're doing the best that you can, connecting with one another through social media, through video games, if you're doing things maybe outside. But unfortunately, now that the weather has turned cold, it's getting dark earlier. It really makes that more difficult. So all of these stressors are being felt by you and your family and your friends. So this COVID fatigue um, is really hitting a lot of us. So what are some of the symptoms of COVID-19 fatigue? So exhaustion, physical and mental fatigue, lack of energy, feelings of constantly being overwhelmed, maybe sad, a little helpless. We are used to having control, to some extent, control over our lives. And right now, we just don't. We don't have that control. It's a very uncomfortable feeling, and nobody likes to feel helpless and out of control. So it's really difficult. Also, the inability to complete daily tasks. Everybody says, "Well, just do your best, just do your best," and I keep saying, just get through the day. There are going to be those days where you're really killing it. You got everything done, you took a shower, you ate well, and everything is going great. And then there are going to be those days where you made it to your Zoom class, but you're still in your pajamas. And guess what? That's okay. That's not okay if it's every day, but again, we're all going to have those days where we're just happy to get through. Increased irritability. So, we're all home together, and everybody's getting on everybody's nerves at some point. So we are really feeling irritable. And again, with that lack of control over our daily lives, we're really feeling that irritability more. Reduced work performance. So, everybody wants to do their best at school, at work, and we do. But right now, you have to give yourself a break sometimes and cut yourself a little bit of slack. I'm not saying don't do your schoolwork. I definitely you still want to get good grades and do the best that you can with your online learning, but you need to cut yourself a little slack. Especially if you're one of these really high performing kids. I have one of those, and so I know how hard they can be on themselves. So if you're feeling a little bit of like reduced work performance, it's okay. It's again, it's not every day, but that's just kind of where we are right now. And then just feeling like you're isolating from others, with social distancing and people not being able to gather and socialize, we're really feeling isolated. And, when you have a lot of these symptoms of this COVID fatigue, it makes it really more difficult to be resilient. It makes it harder to make those smart decisions. We are getting worn out. And we know the right thing to do, and we are just it's hard. Every day it gets harder and harder to do the right thing, but we still try because we know that we need to be responsible and be safe. And there's also, the issue of the activities and the things that we would do to cope with stress, like exercise or hang out with your friends. We can't do those things right now. And that really is taking its toll. So I really want to stress this a lot. Your feelings are valid. I know that a lot of you are leaders in your on your team or in the classroom, and you have peers that look up to you. Maybe you're a mentor, and you want to have that brave face, which is great. But there are times where you just need to tap out. You just need to tap out. You need to take a break. You need to acknowledge how you're feeling. If you don't have don't hide your feelings under a smile. If you don't have a smile, then don't smile. Allow yourself to feel hurt. Allow yourself to feel sad, disappointed. Feel those feelings, because they're very valid. Everyone is feeling that, and you will be much better able to support others if you're taking care of yourself. A lot of people are using this time for growth because there is a lot to be learned from disappointments, developing resiliency. Um, you know, I'm looking around, just my own kids, and I'm seeing a lot of organizational skills they're learning, time management skills. So there are definitely some, we call them the COVID silver linings, right? So they are there. You can find them. So you just kind of have to, you know, make the best of our situation. So what do we do? So, we recognize that COVID fatigue is a real thing. We recognize the symptoms of it. So now what? So now what do we do? We're feeling burnt out. We have had it. We are just to our limit with all of this COVID. And for you guys, again, being peer leaders, your teammates, classmates, they may be looking to you for support, for guidance. And so, how can you be there for them while also taking care of yourself? Like I mentioned in the last slide, at any time you need to take care of yourself first, right? Make sure that you're acknowledging how you're feeling and that you're getting the support that you need. But when you are dealing with your peers, even when you're dealing with family members, it's important that you set your boundaries. So setting boundaries is essential for your mental and physical well-being. You can set boundaries around everything from what you will talk about and engage with to what you're willing to physically do with someone who's not taking things seriously. It's important to communicate your needs and expectations in a way that's respectful but firm. So what does all that mean? So basically what that means is, um, you don't have to engage in conversations that are upsetting to you. You don't have to engage in conversations that make you angry. If it's conversations around, with somebody who's not taking the pandemic seriously, you don't have to do it. You don't have to get yourself all riled up and upset trying to convince somebody else why they need to take this seriously. So if these are people that are your friends, the people you want to remain in your life, you need to set those boundaries and say, hey, you know stop right there. We're just not, how about we just don't talk about, XYZ, because we know it's not going to go anywhere. You're not going to change my mind and I'm not going to change yours. So those are the type of boundaries. And then physical boundaries would be, when people are inviting you to parties that are unsafe, respectfully decline, but firmly let it be known that, that's not a situation I want to, be in. It's not safe given the current state of our, public health, um, the pandemic at this time. So it's really hard to do the next thing that I'm going to talk about, but we really need to try. So you want to try to leave out the criticism. So it's not your responsibility to educate your family and friends about the safety measures. Everybody knows the right thing to do, but not everyone's doing it. So, but if you do want to try to share information to discuss the safety measures, you want to do it in a way that communicates your concerns without criticism. So you really want to just, stick to the facts and share the information and just keep the judgment and criticism out of it. Because if you don't, it's really not going to go anywhere. It's just going to go bad. So there's always going to be those who are rule breakers, right? So we have gone 9 months with this pandemic, and we have all come in contact with people who won't wear masks, who won't social distance, who continue to gather. And there are many reasons why, from, them just not wanting to wear a mask. Some people are just rebellious. Other people have their political reasons. For whatever the reason may be, there are folks out there who are breaking the rules, who are not following the safety precautions put in place. So some of these people may be teammates of yours, classmates, friends, family members. And again, these are people that you care about, that you want in your life. So you somehow have to make it work, right? So how do you have those conversations with them? What do you do? So start by asking them to share their feelings with you so you can maybe understand, maybe empathize with them. Listen to them. That's probably the most important thing. Listen to them without judgment, without criticism. You want to focus on, understanding what they want and what they don't want, like understanding like what is the root of their issue, what their concern really is. You always want to come from a place of kindness, right? A place of respect, because again, these are people in your life that are important to you, so you want to maintain those relationships. So when you're having these types of discussions, you want to keep them respectful, and you're always coming from a place of kindness. And what you don't want to do, and I know it's tempting, but you don't want to release all your pent up quarantine rage during these conversations, because we all know where that's going to end up. So if you just don't do that. Just if you can't do it with kindness and you can't talk to them, trying to understand, maybe just walk away and take a break, and maybe you can revisit that conversation at a later date. Now, a lot of the signs and symptoms that we talked about for the COVID-19 fatigue are similar to signs and symptoms of depression. So I've listed the signs of the symptoms of depression here. The difference is depression is a diagnosable, treatable illness, and it's diagnosed by a doctor. And you would have experienced 5 or more of these symptoms for 2 weeks or longer to be diagnosed with depression. And the COVID fatigue, while it can definitely get worse and lead to a point where people are feeling depressed, actual clinical depression is a little bit different. So you'd want to make sure that you're kind of keeping, maybe keep a journal for yourself to see, how am I feeling today, and just just keep looking at yourself and feeling and recognizing your feelings, how long the symptoms are lasting. And if you do get to a point where you feel that you are having symptoms of depression, then you definitely want to reach out for help. You want to contact your doctor, or you want to call one of the resources that I'm going to share on the last slide. Because again, depression, anxiety, treatable. There's medication, counseling, meditation, all different types of ways that you can treat your depression and anxiety. Now, the last symptom here is thinking or talking about death, suicide, or self-harm. That is really, really important. And I want to just spend a couple minutes on that. If you are considering suicide, if you have thoughts of killing yourself, you want to seek help from a trusted adult as soon as possible. If you do not feel that there is somebody in your life that you can share that with, I would beg you to reach out to one of the resources that I'm going to share with you, because people are struggling and they're in that dark place. It's really hard for them to see a way out sometimes. And I just, if they could just reach out and get some help. Also, if a friend were to confide in you that they were thinking of suicide, thinking of killing themselves, and have asked you, not to share that with anybody, you share it. Absolutely. You don't keep that a secret, because oftentimes, people are reaching out, and they're not able to really get that help for themselves. So it's much better to break that promise, because it could definitely save their life. So that's very important. So what can you do to feel better? So here we are with, COVID fatigue. We're bored in the house and we are just, really struggling. What can we do? Well, you want to connect. You want to maintain those relationships. You want to talk about it. You want to talk it out. Lean on your support systems. Be a support system for someone else. Again, I know, because of your leadership roles on your teams and in the classroom, you are in a position to connect people, right? You're in a position to, start that group text and get everybody talking. If there are people that you're not hearing from, right? It's been a while, I haven't heard from so-and-so, you reach out to them. Everybody should be connecting with each other right now and checking up on each other. Take a break. I cannot stress this enough. It is so important to just tap out sometimes. Just take a break. Take a break from social media, take a break from friends, take a break from family. Just take a break, even if it's for an hour or a day. Sometimes you just need time to mentally recover from the stress of all of these, pandemic stressors. And you want to practice coping skills. We all have our coping skills. Sometimes, we're not able right now to do what we would normally do. If it's go to the gym or, play your sport, none of that can happen right now. So, it's time to find something else. Maybe it's music, maybe it's drawing or reading a good book. Exercise. Nope, we can't go to the gyms right now, but you have a pair of sneakers, put on a warm coat and, go take a walk or take a run, or, run the stairs in your house if you have stairs. Find something to get that heart rate up, just kind of get out of your head for a little bit. Yoga, there's tons of free online exercise videos right now. There's yoga videos, meditation. There's tons of free content out there that you can access to kind of help you get out of your head a little bit. So, in addition, you want to focus on your mental and physical health. So there are a few things that are super important right now when things are so out of control and we have just so little control over our environments. You want to make a routine. You want to stick to your routine. You want to get up at the same time each day, take a shower, put clothes on, go to school, even if that school is in your bedroom. You want to eat meals that are nutritious. A lot of you are athletes, and although you're probably not following, training diet, you should at least be, you know, trying to make good, healthy choices. Because when you're not, then your body feels, weighed down. You just don't feel great when you're not eating well. So definitely, follow your routine. Sleep. I cannot stress enough how important it is to get good quality sleep. And what is good quality sleep? It is getting into your bed. It is turning off your phone or putting your phone face down, not in your bed, not under your pillow, but on a nightstand or on the floor, wherever it is. Just turning off the light, turning over and going to sleep, not having the phone in your face and having it, literally fall on your face because you fell asleep watching it. And then, when you wake up, don't pick up the phone as the first thing. Try it. Just try it. Even if it, there's 7 days in a week, if you could not pick up your phone the first thing in the morning, like start 2 days a week and then, increase it, but eventually get to a place where you don't start your day with that onslaught of media and pandemic stressors. It's all right there in that little phone. And it's as soon as you open your eyes, it's the first thing that you have. That's the first, input into your day. It's just not the way to start off your day. So, yeah, so you just only want to, get some restrictions on that phone. Practicing positive self-talk. This is really important because, we're in our heads all the time. We're talking to ourselves in our heads all the time. And we can make a difference, if we're all doom and gloom and we're not trying to see any silver linings and, we're not trying to, look far ahead to, kind of some small, rewards or some small accomplishments, small things to look forward to, that is really going to help us. If we're only thinking negative, 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 our mental state is just not going to be great. So try to find those small things to look forward to. And those small successes during this time, because again, we have such little control over what's happening in the world. We can at least try to get a little control of ourselves. And I would encourage you through your leadership in your group to share this information and share this with your peers. You want to encourage them to do the same. Maybe there's some way that, you guys can come up with a kind of a routine. There can be opportunities here for you to take the initiative to really try to get folks, on a positive trajectory. Oh, that's a big word. So all of these things are important, and allow yourself to rest and recover. I know I said it before, but I'm going to say it again. Sometimes you just have to check out a little bit and give yourself an opportunity to unplug and reset. It's very, very important. Unfortunately, because we are seeing a lot of unscheduled time, right? The teens are not, we are a very, very scheduled society, and our teens are heavily scheduled. And right now they're not. So they're finding themselves a lot of free time, and that can maybe lead to some experimentation and risky behaviors with drugs, alcohol, and vaping. I'm going to start with vaping because it's kind of a hot topic for me. We do vaping programs starting at 6th grade because unfortunately the kids are vaping in 6th grade. So we research vaping heavily. And right now is not the time to take up vaping because they're finding that the potential there's a potential increased COVID risk if you're vaping, and it really harms your lung health and your immune function. So now is not the time to start experimenting with vaping. And if you are somebody who has been vaping and continues to vape, you probably have a nicotine addiction at this point. Nicotine is so easy for teens to get addicted to. You definitely want to try to look for some resources and try to get some help with that, because it's a really, really, risky time to be vaping with COVID. alcohol use. So a lot of time at home, and a lot of homes have alcohol. So we're finding that a lot of kids are experimenting. A lot of kids are, just taking that alcohol and helping themselves. So again, you guys are in a position to influence some of your peers where this is concerned. So, set a good example, maybe have that discussion and really, if you hear through your group text or wherever you're talking that, this is going on, maybe speak up and just talk a little bit about that and why it's probably not a great idea to be drinking underage at all, but also during this time when people are, it's almost like a self-medicating, when you're feeling this COVID fatigue and you're just really down, drinking or taking drugs is really not going to help the situation. So these are the mental health services, the resources that I wanted to share. I'm going to be sending this as an email as well so that you can all have it. This is something that I have pinned to the bulletin board in my kitchen. Again, I have 3 teenagers in my house. I feel it's really important that these services and these contacts be readily available. Yep, we're parents, we're involved parents, but a lot of times, teens don't want to talk to their parents about everything. So if I can share these resources, and maybe, they reach out and use them, then that's what I want to do. So we're going to share this with you. Well, that brings me to the end of my presentation. Again, I want to thank you guys for inviting me. I hope that I helped you understand a little bit about COVID fatigue, how, what the signs and symptoms are, how you can, um, you know, help yourself and others, as, we're all just trying to navigate this really difficult time. So once again, thank you, and everybody stay safe.